Hey humans and more, it is time to therapy, let's talk. So we're going to treat these like sessions, right? So this is more of a didactic session where I'm basically doing most of the talking and you're thinking while I'm talking, and whether you're agreeing or disagreeing, we're here. So let's go. This session, we are going to discuss in-person therapy versus virtual therapy. Do I believe that there's a place for virtual therapy? Absolutely. Yeah. But if you have a chance to do in person, that is always, excuse me, always the way to go when possible, right? That's the caveat. And I'm going to tell you why. So we're going to jump into these 5 reasons and let's see what you have to say at the end. The first one is hygiene. Your personal hygiene is a huge tip off to me as a clinician if something is going on beyond what you're telling me, right? I cannot smell you over this virtual interaction. I don't know if you are bathing properly. I don't know if your breath smells. Oh, see? Made my thing run away. I can't smell you. I don't know if you've developed some type of odor because you're not taking care of yourself, and that is a symptom of several mental health disorders. That will help me understand beyond what you're presenting to me, right? So hygiene is a huge tip-off for depression, schizophrenia, bipolar disorder, many other mental health disorders that I won't have a clue about if we're doing this virtually, right? You could just wipe the front of your teeth if need be, and I would be none the wiser, right? So that's one key thing. I can't check your hygiene. The next thing is paralanguage and tics. What is paralanguage? Well, paralanguage are grunts, kind of little gestures you may make, different noises. It's a different type of nonverbal, but it's like semi-verbal. There are levels to paralanguage. If I make a comment and you kind of go say something under your breath, I may not catch that, right? And that's the type of paralanguage. So I may say something, you may go, you could go, and if I don't hear, the could be the thing that I need to turn the whole conversation around. So that's something you may miss in virtual sessions. Also, I don't know if under this you are shaking your leg, you're tapping the table. I don't know if you're having any of those kind of nervous tics, which would help me direct the conversation and navigate through what you're not telling me, right? Nonverbals as well, huge. I can't see that from neck up, chest up. I don't know what you got going on. That's problematic. The next thing would be if there's an emergency. That is a huge safety issue. I actually had this happen to one of my clinicians, a friend of mine. She was doing a virtual session with somebody in a totally different state. It was a different county. And the person started having suicidal ideations, homicidal ideations, and then they hung up the phone, right? Which is terrifying as a clinician because I don't know what just happened, right? I don't know if you're going to go hurt somebody. I don't know if you're going to go hurt yourself. In that situation, that virtual session, the person was not at their house. So that clinician did not have the address to where that person was, so they could maybe send the police for a wellness check. It was a lot going on. And that's something that you have to be very mindful of. I will do a video on, best practices, in my opinion, from my experience, if you are going to do a virtual session, because I do them. I do. But yeah, that's huge, right? If there's an emergency situation, it could be such a huge safety issue. Okay, we had to take a little break, but we're back. Number 4, confidentiality. The whole purpose of therapy, well, one of the main things about therapy, the joy of it, is the anonymity, right? I have had several sessions virtually where that person does not want to talk. Why? Because the walls are too thin. Because they're afraid that the person that they're talking about is listening in on our conversation. So they are now reduced to just giving me the bare minimum. They may want to be ready to shout to the mountains everything that is disturbing them, but they just can't do that, right? Because they're in a position where they do not have that ability to have complete confidentiality. And that's not fair. That's not fair to you as the client, and that's not fair to me as the clinician, right? Because I want you to be able to get that out. I want to be able to find out what's going on so I could best help you. Because ultimately the goal is to get you to a place where you are managing these issues as they come on your own, right? You are able to handle these things and progress. So confidentiality is huge. Also, if you're working with somebody who's, let's say, in a domestic violence situation, maybe you know, maybe you don't know, I don't know. But I can only see as a clinician here and here. I can't see who's in front of you, right? So if you're wanting to tell me something, or better yet, if somebody is wanting to filter the information you're providing, they can do that, right? Because I can't see what's in front of you. They may be there telling you only say certain things, don't talk about this, only mention that, filtering the information, which is hindering the helping process. So that's a huge one. Confidentiality, somebody could be in the room. It could just stop you from getting the most out of your session. And it also doesn't allow me to make sure that you're truly in a safe space, which is something that I'm able to at least provide in a sense through an in-person session, right? Or it should be. So that's a huge one. I have had so many examples of this, working with teenagers, working with adults, working with couples, right? We'll do a couple session and I'll have one go out of the room so I could talk to the other one, get a little more insight, and that their fear or their concern, and sometimes very valid, is that their partner's listening in at the door, or they haven't fully left the room, right? They just kind of stay close by. And that could be very dangerous, especially if you're working with people who are experiencing, again, domestic violence, because their abuser could be in the house. Their abuser could be there making sure that court-ordered therapy that you as the client are getting is not too much on them, right? It could be tricky. So confidentiality definitely can be a huge thing. Siblings, they may want to talk trash about the other sibling. That is your right in therapy. But you can't do that now because of the space that you're in. So those are some of the main issues when we talk about confidentiality in virtual sessions. Number 5, distracted people. Of course, that's number 5, right? In therapy, we're here to focus. I'm watching, I'm paying attention. I've had sessions where, let's say that the client was non-compliant, to say the least. They may or may not have been court ordered. So they were there for their session, but they were there watching TV, right? Or they had 30 or 40 minutes they could give me. We couldn't do the whole 45 to an hour because they got plans and they're trying to get dressed while we're having our session. Okay. Or they have kids, that they're trying to watch at the same time while having their session, which I do get. I'm a parent. I understand the convenience of that. But, it's also hindersome to the process. It stops you from getting the most out of what you need. So it can be very tricky, right? Distracted people, again, back to that. So I've had situations where we've been in the middle of a session, somebody bursts into the room that they're in, starts a full-blown conversation, and that person's totally distracted, right? I've seen this a lot with teenagers. Let me not do too much with the teenagers because that's not fair. I've seen this with adults too. The point is, it just allows for an air of too much comfort, right? Because it's so easy to do. Another issue with the number 5, right, being distracted, is that if you're dealing with depression, if one of your issues is that you are not getting out of the house enough, am I really doing you a service if we're doing our therapy session in said same room, in your depression room, in your depression space? I I would ideally want to get you out of that space so you can have freer thoughts to flow. Because in that space, right, if that is your oasis and also your, kind of where you put all that negative, depressed energy into, that is going to affect how we have our sessions. That is hindersome to the process. So ideally, if I can get you out of that space and into some fresh air or just into a different view or, a different viewpoint, that can be helpful too. So am I really doing you a service? Let's say you share your room with somebody and now that person, they're tired, they're trying to take a nap and you're trying to have this therapy session, but you have to keep it down, right? That has happened. That has happened to me before. And it is so unfortunate for the client, right? And those kind of situations, what I do is I recommend that we reschedule. But it's to no fault of their own. It's just the situation that they're in, and I get that. So it's one of those things. It's one of those things you have to figure out. It's one of those things that you work out. But yeah, that is definitely my number 5. Distractions, distracted people, being in just in cluttered spaces as well, right? Sometimes when you are surrounded by the things that are adding to your depression, you're in these negative spaces and energy, that's also Henderson because it becomes all that you can talk about in the therapy session because you're looking around, seeing these things that cause you angst and you just are so distracted in your thoughts about it. It's problematic, right? It doesn't allow me to get you out into the world. So those are my top 5. Yes, there are many, many more, but we're going to leave that there. You guys get busy in the comments. Clinicians, bring it on. Clients, bring it on. Let me hear what you have to say. I'm curious. Again, this is not to say that I don't think there's a benefit in virtual therapy, but it is not touching in-person therapy. Hands down, that's the reason why in-person is best practice. Have a good day. Thank you.